Good day everyone, I'm Vanessa Mantilla, a physical therapy intern from Arter Medical Foundation in Tacloban City. I'm here to discuss about an article entitled Exercise Adherence Following Physical Therapy Interventions in Older Adults with Impaired Balance. As what we can perceive from its title, this research article is trying to figure out the adherence to a prescribed home exercise program of older adults whom have had impaired balance and what factors could possibly affect it. Scanning all the way down to its methods, the subjects of the study were clearly described and stated specified numbers, characteristics, and the inclusion and exclusion criteria. Subjects were 556 older adults who are 65 years of age and over who were discharged from physical therapy during the period of 2000 to 2003. Methods of subject selection were through a survey developed to determine participation in a home exercise program. Univariate logistic regressions identified specific barriers and motivators that were associated with exercise participation following discharge from physical therapy. During the development of the survey questionnaire was a selected method of data collection in order to ensure subject anonymity to provide a standard form to decrease potential bias and to reach a large population inexpensively in a short period of time, which is quite efficient in avoiding bias. Sufficient details, references, and information were also observed. Interventions used during the study are also appropriate and goes well with the purpose of the study and its expected result for individual or old people with impaired balance. Research instrumentation was also effective for they had used different strategies or means of giving the surveys without bias. A pilot survey was administered to 5 older adults and 3 physical therapists to reveal any limitations in the design and sequence of questions and to clarify operational definitions. The final survey instrument was a self-administered 43-item questionnaire composed predominantly of close-ended questions. These close-ended questions were developed to provide uniform answers and to simplify coding for data analysis. One open-ended question was included to give respondents an opportunity to describe any new medical problems that had been diagnosed since discharge from either the SAGE or Strong and Steady program. 3 questions include an other category with prompts and lines provided to further describe the response. Neutral and interesting questions were included in the beginning to establish curiosity and subject trust, whereas demographics and more sensitive questions were placed at the end. Questions were grouped according to topics, resulting to the development of the following 7 sections. Moving on with the procedure. Procedure was very systematic. It did describe the steps or procedures that the subject had gone through for the research. Instructions were also given and the patient protection was also observed. Procedure include a cover letter explaining the purpose of the survey and a self-addressed stamped envelope were included with the survey questionnaire. Survey questionnaires were returned anonymously. However, they were color-coded for each program. Reminder postcards were sent out for 4 weeks after the initial mailing. Completion of the questionnaire implied informed consent to participate in the survey. Analysis of data collection is appropriate and adequate for the type of research. Information and references were provided for easy understanding of the statistics. Process of data analysis include the use of descriptive statistics, coded and analyzed in SPSS 28 to summarize demographic and health status data in the 2 groups. Results was presented in a way that confirms the hypothesis. Described here were the findings pertaining to the adherence of all population to home exercise program, wherein it shows that 99% of respondents reported receiving a home exercise program, 37% no longer performed it, and change in health status was the primary reason for poor adherence to HAP. 8 barriers, namely no interest, poor health, weather, depression, weakness, fear of falling, shortness of breath, and low outcome expectation were associated with a lack of post-discharge participation in exercise program. Now for the discussion and conclusion. Both have discussed and generalized the result of the study and discusses findings with relevance to what is expected. Conclusion was brief and only involved text or key findings of the result. Clinical implications were discussed, denoting that the study has a number of implications for the practice of physical therapy. Overall, the study portrayed focus on the subject and their expected outcome all throughout the process. Ideas were systematically and logically in sequence. Professional jargons were observed, but corresponding definition was provided. Journal format followed standard and correct journal style. That's the end of my presentation. Thank you for listening.